Talanoa Hufanga of the San Francisco 49ers suffered a non-contact knee injury in tonight's contest, and the knee injury was severe enough where he actually needed to be carted off of the field. As of right now, we don't have any specifics as to what exactly he is dealing with in terms of the injury. However, the knee position that he went into is known as dynamic knee valgus. And this is actually a very risky position for the knee, and that's something I want to focus on in today's video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Gallo, and I'm a doctor of physical therapy. With my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy, as well as what that person should expect when coming to rehab. If you enjoy this content and you want to see more of it, please hit that thumbs up and subscribe to the channel, because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we can see right here on the injury video that as Hufanga is going to plant with that right foot, that right knee is just going to cave in very awkwardly. Here I have a model of the knee joint, and so the knee joint is formed by that thigh, also known as the femur bone, is going to come on down and form the top portion. The bottom portion is formed by that tibia bone, also known as the shin bone. And on the lateral piece here, we have something known as the fibula bone. All of these together are going to make up the knee joint. There are four main ligaments that contribute to overall knee stability. The first one being the ACL, also known as the anterior cruciate ligament, which is located right in through here. As we flip the model medially, or towards the inside portion of the knee, we have the medial collateral ligament, or the MCL for short. As we flip laterally, or towards the outside, we have the LCL, or the lateral collateral ligament. And finally, as we go towards the back of the model here, we have our posterior cruciate ligament, or the PCL for short. And as you look further into the model here, there are these two structures. These are the medial and the lateral meniscus. You can think of these essentially as shock absorbers between the two bones. Once again, the position that Hufanga's leg goes into is known as dynamic knee valgus. So I want to explain that briefly. Anytime a person is going into a dynamic knee valgus, essentially what this means is the bottom portion of their leg is going to be externally rotated. Following that, where the thigh is going to be internally rotated. And as I do that on the model here, you can see that essentially it's going to stress a lot of the ligaments and soft tissue structures located in the knee. The one that actually gets stressed the most in this position, unfortunately, is that ACL. So as we put that person into external rotation with that femur going internally rotated, most likely that knee caves in as well. That puts a lot of stress going through that ACL. It's also important to say here that anytime a person goes through a dynamic knee valgus, yes, that ACL could be implicated in the injury, as well as the MCL and or a meniscus. So obviously the ACL is the big one when it comes to these non-contact knee injuries, but it's also important to know that other soft tissues can be essentially injured in this position as well. The ACL has a couple different functions. The first one, it's going to essentially prevent any anterior translation of that tibia coming off of the femur like this. And another function it has is it provides a rotational stability of the knee, but when a person goes into dynamic knee valgus, that greatly implicates it because it provides that rotational stability. So right when I see this video, I'm immediately thinking that he is at risk for an ACL injury just because of the mechanism of injury. This is very common when we see non-contact ACL injuries. One other moment in this video that makes me think that the ACL is implicated in this injury is this right here. As he goes through that full motion, it looks like we see that shin or tibia slide slightly forward and then snap backwards towards the end. And if this is the case, this is meaning that he's essentially getting more anterior translation going through his lower leg, which would mean that there is some laxity going through that ACL. When somebody suffers a suspected ACL injury, the first test we're going to do is something known as a Lockman test. And we are essentially reproducing that function of the ACL. So we stabilize that femur, we're going to pull on that tibia, and we want to see if this reproduces the person's pain and or they're getting laxity. And we compare this to the other side. And if the person is getting their pain reproduced, as well as if we feel a lot of anterior translation of that tibia, then that makes us think that the ACL essentially has been injured here. The gold standard to diagnose ACL injuries, of course, is the MRI, and that brings us to our grading system. So there are grades to these ACL injuries. There are grades 1, 2, and 3. In a grade 1, this is where you're getting stretching of the ACL. In a grade 2, you're getting partial tearing. And finally, in a grade 3, you're getting the full rupture. So obviously, best case scenario here, he is dealing with more of a lower grade knee sprain. Worst case scenario, of course, is a full rupture. So we're going to need to wait and see if we get a little more information to determine his exact time frame to when he can return. Thank you so much for tuning in today. If you enjoy this sort of content, I'm going to go ahead and link one of my playlists so that you can watch some of the other videos that I've done in the past. Thank you once again for tuning in, and I'll see you next time.